Hello, I'm Ann Stock, Associate Director of the Center for Advanced Biotechnology in Medicine, or CABM. Today, I have the pleasure of speaking with CABM Director Martin Blaser. He is the Henry Rutgers Chair of the Human Microbiome and Professor in the Departments of Medicine and Pathology and Laboratory Medicine at Robert Wood Johnson Medical School. Marty, can you tell me a little bit about your early education and early career?
Sure. So I'm a medical doctor. I went to medical school. I wanted to become a practicing doctor. I studied internal medicine, and then I decided I should get a kind of specialty under my belt. And by this whole series of steps, I began training in infectious diseases, and I was on a training grant. And the training grant said that if you don't go into academic medicine, you have to pay back your stipend. So I thought, well, I better develop some research so that I can get any kind of academic position. And when I started doing research, I found that I liked it a lot. And it's kind of like the monster that ate Cleveland. After a while, research took over my life, but it's been a great ride, and I've enjoyed it a lot.
Marty, how long have you been at CABM and what brought you here?
Well, I have been at CABM not quite 2 years. And what brought me here was the opportunity to do a good job and to work with good people and try to kind of build something. CABM, as you know, has been around for about 35 years, and had an amazing director, Aaron Shatkin, who did a terrific job, and unfortunately he became ill and he passed away. And and you served for a number of years as the interim director and did a terrific job. And they wanted someone to help. They said, okay, we're going to give you some resources. They wanted someone to help build it up, and so I signed on the dotted line, and that was really my goal, is to see if I can build this place up kind of to where it was in Aaron's days.
What is the main focus of research in your lab?
Well, I work on the human microbiome, and the microbiome is all the microbes that live in and on us. It's an ancient relationship going back really since before there were animals on the earth, and the microbiome does important things, has important functions in human physiology. And I don't know, about almost 20 years ago, I began to think, well, maybe there's something wrong with our microbiome. Maybe our microbiome is changing, and that's what's leading to all these diseases that have come up in the last few decades: obesity, asthma, allergies, worsened inflammatory bowel disease, and certain new cancers. The list goes on and on. So I've, for now, almost 20 years, I've been working on examining that question. How is the microbiome changing? What are we doing to change it? How is it affecting our physiology? And I've been doing it, mostly studying it in animal models, but some work in humans as well.
So can you tell us a little bit about and new projects in your lab and what new project is particularly exciting?
Yeah, well, the new project is really an old project for me. Almost 40 years ago, I heard a lecture about estrogen, about the female hormone of estrogen, and how there's a really important metabolism of estrogen in the gut, that the bacteria in the gut are affecting women's estrogen levels. And that kind of stuck with me. And I always wanted to kind of go back to that. And some years ago, I wrote a review article. We coined the term the estrobolome, the microbes in the gut that affect estrogen metabolism. And not long ago, we began doing studies to see if we gave antibiotics to mice, and that would affect their microbiome, what would happen to estrogen? And we have been doing those studies, and we find that the antibiotics are affecting a very important enzyme that that many gut bacteria have, that breaks a bond between estrogen. Well, I should go back a step and say that when the body makes estrogen, it goes to the liver, and then it's conjugated to a sugar usually and excreted in the bile, and then it gets to the intestine. And if it continues to be conjugated, basically it's excreted. But if it meets, if that molecule meets an enzyme that clips the sugar, then that estrogen can be reabsorbed. And so whether it goes out of the body or stays in the body is determined by the composition of the bacteria and their enzymatic activities. So that's kind of the background of the story, and that was discovered a number of years ago. And we're trying to understand that better and see, can we manipulate estrogen by first with antibiotics to manipulate the microbiome, but can we actually manipulate it more substantially than that? And estrogen is really an important molecule. It affects everything. It affects fertility and menopause and aging and skin and bones. It is really important.
It sounds like that has really great therapeutic potential. Can you tell me how you interact with students, trainees, and other members of your laboratory?
Yeah. Well, I think one of the things that I like so much about research is the opportunity to work with the students and people who are interested in exploring and trying to discover new things. And just about for everybody in the lab, I try to assign them a project so that they have their own project. Obviously, with graduate students, it's very clear, but even with undergraduates, I try to give them their own project, their own little baby that they can work with. And generally, these projects involve teams of people, so that they're not really on their own, but they have something that they can call their own. And I try to meet with everybody in the lab at least once a week formally, notebook in hand, and review what I call the 3 Ps: progress, problems, and plans. Progress, what have they been up to? Where are the problems? Where are they having trouble? And maybe I can help. And what do they plan to do next? And if we just keep doing this in a somewhat endless cycle, and eventually good things come out of it.
Do you have other roles at Rutgers in the scientific community, in the world at large, that you want to comment about?
Well, since COVID, I've been really busy on COVID, and with several colleagues, we have developed some cohorts. Back in February 2020, we could see what was coming, and we knew it was coming our way. And so we decided to try to enroll a cohort of healthcare workers, because these are people who would be at more than average risk for developing COVID, to understand what were the risk factors, who was developing it, what were the clinical consequences of the infection, how were they developing immunity, what are the consequences, what are the laboratory values. And we started a cohort of more than 800 people, which we enrolled in 2 weeks, which was really pretty remarkable. And then we enrolled another cohort of 4,000 healthcare workers later in the spring, and we've been studying those. And now I'm involved in testing of one of the vaccines, the Johnson & Johnson vaccine. We're actually, our site at Rutgers currently is the #2 recruiting site in the United States, after actually in all their studies out of more than 200 sites. So we've been very, very busy on this, but it's what could be more important? One other thing that I do is that I've been serving since 2015 as the chair of the Presidential Advisory Council for Combating Antibiotic-Resistant Bacteria. I was appointed by President Obama. It's continued through the current administration, and I was renewed. I have a few more years to run. And the idea is to kind of change how both doctors and other health practitioners and farmers are using antibiotics, so that we can preserve this precious legacy for future generations. Otherwise, we're going to be in big trouble.
How would you like to be remembered for your scientific work?
Yeah, that's a hard question. I think for me, science has been a great journey. I have really loved the process of setting off in some direction and then being detoured into another direction and another. It's been a journey, and like many journeys, what makes it pleasurable is the people you journey with. And so, I've really enjoyed the interactions I've had with the people in the lab, my colleagues. It's been a terrific voyage.
Are there any important subjects that we have missed covering so far?
Just how much I appreciate you as a colleague and your work and your very positive can-do attitude. It's a pleasure. Thank you.
Thank you, Marty.